How do you treat a laceration? Have you ever wondered what to do if you or someone else gets a cut or tear in the skin? A laceration can happen in the blink of an eye, and knowing how to treat it can make a big difference. Let's break down the steps to effectively treat a laceration, especially in a survival situation. First, ensure that you and the injured person are safe. Look around to make sure there are no immediate dangers. Once you are in a safe spot, check the wound. If there is heavy bleeding, stopping it is your first goal. Use a clean cloth or bandage and apply firm, direct pressure to the wound. If possible, keep the injured area elevated above the heart. This can help slow down the bleeding. Once the bleeding is under control, it is time to clean the wound. Rinse the laceration thoroughly with clean water. This helps remove dirt and debris. If you have soap, wash the skin around the wound, but be careful not to get soap inside the cut. If you notice any debris still in the wound, you can gently scrub it with a clean cloth or use tweezers if you have them. Remember, using dirty tools or hands can lead to infection, so always prioritize cleanliness. After cleaning, dry the area with a clean cloth. If you have antibiotic ointment, apply it to the wound. This can help prevent infection. Next, cover the laceration with a sterile bandage or a clean cloth. This protects the wound from dirt and bacteria. Be sure to change the dressing regularly, especially if it becomes wet or dirty. Keep an eye on the wound for any signs of infection. Look for redness, swelling, pus, or increased pain. If you notice any of these symptoms, continue to keep the wound clean and seek medical help as soon as possible. In survival situations, you may not have access to medical supplies. You can use what you have on hand, like clean clothing or bandanas, to create a makeshift bandage. Always remember that keeping the wound clean is essential to reduce the risk of infection. If the laceration is deep or long, or if you cannot stop the bleeding, it is important to seek professional medical help. In remote areas, this may not be possible, so focus on keeping the wound clean and protected until help arrives. To be prepared for any situation, always carry a basic first aid kit. This should include bandages, antiseptic wipes, and antibiotic ointment. Knowing how to improvise with what you have can be a lifesaver. Stay calm and reassure the injured person, as shock can make the situation worse. By following these steps, you can effectively treat a laceration and improve the chances of a safe recovery.